every woman is going to go through menopause. Sex should never be painful. During arousal, the vagina widens and lengthens to prepare for penetration. Welcome back today to the Rena Malik MD podcast. I'm your host, Dr. Rena Malik, urologist and pelvic surgeon. And today we're going to be going over our Ask Me Anything series. So without further ado, let's get to our first question. Now, if you want your question answered, make sure to check out our membership at renamalik.supercast.com, where you can join to be a member and get early access to our podcast episodes, as well as Ask Me Anything to get your question featured on our monthly Ask Me Anything episodes.
First question. I'm a 45-year-old woman. I'm unmarried, but I have a son that I've raised after having IVF. He's been saying I've become more irritable than usual. I came across some of your content online and realized you mentioned some early signs for menopause and got me thinking I have it. I don't know what to look for or if I need a blood test or something. I don't have a husband, so not having sex, but I do get naturally lubricated on my own when I am turned on, so not worried if my vagina isn't working properly. Just worried maybe my hormones are unbalanced, causing me to stress too much. This is from initials JR in Rhode Island.
All right, JR, thank you for asking. I think this is a really important discussion that all women need to have because every woman is going to go through menopause. Now, the average age of menopause is 51. And what is menopause? Menopause is when you've had no periods for over 12 months. So generally speaking, when we say on average is 51, that means some will have menopause earlier, some will have menopause later. But perimenopause or premenopause can start up to 10 years before that date. Now, how do you know that you're in premenopause? So the first thing you're going to notice potentially is that your periods become a bit irregular. You may notice that sometimes they're heavier, sometimes they're lighter. They start to slowly become further and further apart. So that is, usually a hallmark sign. But you may also notice other issues. So one, as you mentioned, is having some sort of changes in sleep patterns, in brain fog, in potentially even having hot flashes. Those can start well before menopause. And hot flashes, people think it's like, oh, you're really sweaty, you're really hot. You'll see like this viral video of like steam coming off someone's head. But sometimes it can even just be being irritable. So being irritable that lasts for a short period of time and then goes away and is happening periodically throughout the day could be a sign of premenopause. The other thing is you may start noticing that because of this, you're more irritable. Potentially, you're feeling less like yourself. That's probably the most common thing that people will say is that they feel less like themselves. There's also a whole host of other symptoms that people don't often talk about. You might notice crepey skin, frozen shoulder, musculoskeletal symptoms. Now, these are more vague and not generally specific to menopause, but we know that the more symptoms you have, the more likely you are going through the transition. Now, in terms of treating this or first diagnosing it, so diagnosis is traditionally just looking at your symptoms. Now, people will try to sell you all sorts of testing to check your hormone levels, but perimenopause is like a roller coaster. One day your estrogen will be really, really high, and the next day it will be really, really low. So you hear things like estrogen dominance, all these sorts of things, but ultimately it's just a roller coaster. Some days you're going to be high in estrogen, some days you're going to be low, some days your progesterone will be higher, some days it will be lower. So getting blood tests during this time are not necessarily going to be particularly helpful. So essentially, if you are having symptoms, which include vasomotor symptoms like hot flashes, or you're at risk for osteoporosis, those are FDA-approved indications for hormone replacement therapy. That does not mean that if you're having these other symptoms and you score high on potentially a test looking at, menopausal symptoms, that you're not a candidate. It is just certainly those are the ones that are FDA approved. Now, in terms of starting hormone therapy, it's a very important discussion to have with your doctor. It is very safe, but of course there are risk factors with anything that you start. And there's a multitude of ways to approach hormone replacement. But the most important things to realize are if you still have a uterus, you need to add progesterone to any estrogen you take. Estrogen can come in gel, patch, pill form and even injectable. Progesterone can also come in pill or patch form. Progesterone creams do not work. And occasionally testosterone can be added, most commonly for things like low libido, but also testosterone helps with a variety of other things in the body as well. So it's a long discussion, but essentially, yes, you may be going through perimenopause, and it may be valuable to discuss that with your primary care doctor or look on the Menopause Society website to find a Menopause Society certified practitioner, which I am, and many other doctors around the United States are as well.
Sounds good. Next question is actually from a female, initials LS. I have pain with sex every time. Anytime a man puts his penis in me, I feel sharp pain. I don't hear these complaints from my sisters or my other girlfriends. I think my vagina is too small. I've been with average men. I'm assuming she means average size men. And even they scare me. It makes me not like sex, which sucks because I do get turned on by men. And I do enjoy oral sex, but I just can't handle the penetration. And I've tried the stuff from CVS to add lube, and I still get pain. Am I too small, or is there a way to fix this pain?
So sex should never be painful. And thank you for asking this, because I think a lot of women will just live with this issue and feel like they're broken. But in reality, sex should never be painful. So if you're having pain with sex, it is worth getting investigated to identify what the cause is, because there's a variety of different causes. Now, you mentioned lube. Inadequate lubrication is one of the causes, certainly for some women. Looks like you've tried to address this. Just for other women listening, I will say that when you buy lubricant, you do want to make sure that you have a sufficient amount of either reapplication of lubrication throughout sex, because when you use a water-based lubricant, which are the most common ones, those will evaporate and you'll need to reapply. Now, silicone-based and oil-based lubricants will last longer, and you'll probably need to use less of it. So it may be worth experimenting with those if some women are having pain with sex. The other issue that sometimes comes up is that you're not getting adequate time for arousal. During arousal, the vagina widens and lengthens to prepare for penetration. And so you need to make sure you're sufficiently aroused. Now, most women will notice they're aroused because of lubrication, but if you rush too quickly, you may not have enough time for that physiologic change to happen. And for some women, it can take up to 25 minutes for arousal to complete. And so that's really important. Next up, what are other causes that can be corrected that are causing pain with sex? So very commonly, we'll see pelvic floor dysfunction. Now, the pelvic floor is a bowl of muscles that sits in your pelvis that holds everything up. And these muscles, just like any other muscles, can have dysfunction with them. And the issue is that we often don't realize that we're having pelvic floor dysfunction. It can present itself through pain with sex, through urinary frequency, constipation, even lower back pain or hip pain. All of these things can be related to pelvic floor dysfunction. So to determine if you have pelvic floor dysfunction, you can try to assess by feeling in the vagina to feel if those muscles feel tense, but it may be difficult for you if you've never sort of figured that out before. But more importantly is to see an expert in the pelvic floor, a urologist, a gynecologist, a pelvic floor physical therapist to examine you to assess if you have high tone in the pelvic floor. If you do, then getting that treated with pelvic floor physical therapy or other options can be helpful in alleviating that stress in the pelvic floor and then allowing you to have more comfortable, pain-free sex. Now, there's other things as well. There can be hormonal issues like vestibulodynia or pudendal neuralgia, which are more complex sort of hormonal or nerve issues that can cause pain. But again, I think that the take-home point is to find someone who's an expert in sexual dysfunction, get an evaluation to see what is the next best step to getting you to have pain-free sex, because it is possible and should be. Even if you are on average have a smaller vaginal size, you should be able to have comfortable penetration.
As a follow-up question, it's a question that gets brought up in the comments since we already discussed, the average size of male genitalia. We do get questions on what's the size of the female genitalia, like what is the vaginal canal length or maybe even the opening of the vagina. Like, are there numbers that are averages out there?
Yeah. So the average is about 3.7 inches. or 9.5 centimeters if you're not in the US. And so that is significantly smaller than average penile length, which is about 5.4 inches. But as I mentioned, during arousal, the vagina will lengthen and widen, and it will add about 1.5 to 2 inches in length, which then matches the average penile length for the average vaginal length. Now, of course, there is some fit, right? Some women will have naturally smaller vaginas, and some women will have naturally longer vaginas or wider vaginas. The width also changes. And on average, it starts, being smaller at the opening and widens closer to the top of the apex or near the cervix. And again, there's a variation there as well, somewhere between 1 to 2 inches. But again, that will relax and widen and lubricate as well. So during arousal. So ultimately, I think the key here is that most men and most women will fit each other. But of course, there are times when there is no fit. And sometimes the male is longer and it's uncomfortable for penetration. Now, there are options that you can buy, like buffers. ONUT is one that's available. We're not sponsored by them, but that can help alleviate how much is being penetrated so that it can be more comfortable for women where the fit may not be as great.
All right. Next question. My urine looks cloudy and grayer than usual. It used to be clear. I thought I had an infection, but I don't feel anything different down there. It just looks less clear as it used to. Just started a week ago. This is from LL.
Yeah, so cloudy urine is a very common complaint. And I think the most important thing to take home is that when you have cloudy urine, if you have no symptoms, meaning you do not have pain when you urinate, you do not have pain in your lower belly or pain in your kidneys, which is sort of in the back on the side, or you're not going to the bathroom more frequently, more urgently, those are signs of a urinary tract infection, and that needs to be treated. But if you just have cloudy urine or stinky urine for that matter, that could be from a variety of different things. It could be that you drank or ate something that's changing the odor of your urine. Your urine could be concentrated because you didn't drink enough fluid that day. So what I tell people is if you notice it's cloudy or you notice it's stinky, drink more fluids to help sort of flush out whatever is going on, ideally water, to help flush out whatever is going on in the bladder. The other thing is our bodies are amazing. About 40% of the time, your body can treat a UTI even on its own. So yeah, you might have some bacteria in the urine. We now know that urine is not sterile. So there's always a little bit of bacteria in the urine, but your body does a great job of taking care of it. So the only time you need to worry is if you have those symptoms of a UTI. Otherwise, drink more fluids and try to see if that clears things up. Of course, if it doesn't, I would still recommend seeing your doctor to just make sure there's no blood in the urine or protein or other things that need further investigation. If you want to hear the rest of the Ask Me Anything episode, make sure to join our premium membership at rinamalik.supercast.com. There you can get access to Ask Me Anything to get your question featured on our future episodes and to access ad-free episodes and early access to all our episodes, as well as transcripts from the podcast. And as always, remember to take care of yourself because you're worth it.